Hello, everyone, and welcome to our webinar this evening. We are just going to give people a chance to join us, and then we will start with our regular scheduled programming. Okay, so welcome everyone this evening to our webinar, Optimizing Colostrum Management with a focus on enrichment. I will be your host this evening, Sydney Fortier. I'm a digital communication specialist with SCCL, who is putting on the webinar this evening. I'm very grateful to be joined by two leaders in colostrum management and research, Dr. Dave Renaud and Dr. Kimberly Eagen. And you will hear from them very, very shortly. I just kind of wanted to go over a few things about how this webinar is going to roll out. So right now we're in the middle of opening remarks, followed by our presentations, and then we will have a live Q&A. So as your questions come up, please feel free to put them into the Q&A, and we will address them in that live session as it comes up. If you have questions and you don't put them into the end, do not worry about that. We will be rolling through as many as we can during that session. And yeah. Just a reminder that this is also a CE accredited event. If you are a vet or a vet tech in the US or Canada, I recommend you scan the QR code and so that you can register for this event and receive that CE accreditation. If you miss it here on this slide, I will have it up again during the Q&A. So do not panic. And if for whatever reason you have any trouble, feel free to reach out to myself or anyone else at SCCL, and we should be able to give you a hand. But without further ado, I'm going to pass it over to Dr. Dave Renaud, who's going to kick us off in terms of our presentation. So Dave.
Great, thanks, Sydney. So for those of you that don't know who I am, my name is Dave Renaud. I'm a professor at the University of Guelph. And recently we've been doing quite a bit of work in collaboration with Mike Steele on the role of colostrum really improving calf health. Where I thought we'd have a bit of a starting conversation is really the importance of early life care. We know that things that happen early in life have pretty profound impacts on the remainder of that animal's life. Specifically, if we look at kind of the growth from a calf into a mature cow, we know that calves that have diarrhea or respiratory disease have reductions in milk production. Specifically for diarrhea, it's about 325 kilogram reduction. For respiratory disease, it ranges between 200 to 500 kilogram reduction in milk production. Also, what we know is that growth in early life is also substantially important in their future productivity. And for every 100 grams per day more you get in pre-weaning average daily gain, it's associated between 130 to 155 kilograms more milk in first lactation. So hopefully you're here, you understand that what we do in early life has a substantial impact. One of the central things in terms of how we can prevent disease, how we can improve development in early life, is really by focusing on colostrum management. We know from recent studies, from older studies, that really colostrum is the central part in laying the foundation for a calf's future success. And if we can get this right, we can do a lot of other things right. If we think about why colostrum matters, it really comes down to as simple as this. When the calf is in utero, the type of placenta that a cow has doesn't allow any of these Y-shaped IgGs or immunoglobulins to transfer through towards that calf or enter into the bloodstream. So as a result, that calf is born completely immunonaive, so has no ability to protect itself against disease should it be infected with a disease-causing pathogen. So that's why colostrum is so important and why the first feeding of colostrum has such a substantial impact. If we look at kind of what happens, kind of looking more microscopically at the intestinal lumen, we know that when calves absorb these immunoglobulins, it happens through a process called penocytosis. So they consume the colostrum, These Y-shaped IgGs go down to the intestinal lumen. And then ultimately, what they do is they form this endosome, and they're absorbed through the intestinal cell through a process called penocytosis. We know that some will end up in the bloodstream, and we also know that some are going to end up back in the intestinal lumen, where they act as some localized protection to help protect that calf against disease or some disease-causing pathogens. When we zoom in on what's happening in the bloodstream, if we have infection with viruses or bacteria, what happens is these immunoglobulins will bind to these viruses and bacteria and make it easier for immune cells like neutrophils to come in and kill those viruses and kill those bacteria. So that's why it's so important that in early life, we really ensure that these calves consume enough immunoglobulins so that they can help fight off these disease-causing pathogens. So how much do we want to achieve? How much IgG do you ideally want in the bloodstream? So if we look at the Holstein calf, where we've traditionally been is we've tried to achieve, ideally, not have any calves that are in this category, this less than 10 grams of IgG absorbed per liter of blood in that calf. And the reason that we've tried to achieve more than 10 grams per liter is that calves that are in this failure level or less than 10 grams of IgG per liter of blood are much more likely to die, so 2 times higher risk of mortality. They're much more likely to get diarrhea, and they're also much more likely to get respiratory disease. So that's looking at a purebred Holstein calf. If we look at non-replacement calves, which have kind of morphed towards these crossbred animals or these Angus Holstein predominantly crosses, it also matters for these calves as well. We want to achieve ideally more than this 10 grams of IgG per liter of blood. And specifically in calves that have this failure, they have about 2.5 times higher risk of mortality, and they also have a 3 times higher risk of diarrhea. Further, when they looked at respiratory disease, they didn't find a significant effect, but it was around a 1.5 times higher risk of pneumonia. So hopefully what you can take away from this is that we want to achieve calves, or want calves to achieve ideally more than this 10 grams of IgG per liter to really help to protect them from risk of mortality and other diseases. Recently, though, there's been some pretty good data showing that we need to achieve much higher than we traditionally thought, much higher than this 10 grams of IgG. And this is some data that I pulled from a paper that Jason Lombard did, who's at Colorado State University, and also from Angel Aboye's group, who's at Michigan State University. And what they did was they looked at the 4 different Lombard categories. So less than 10 being our traditional kind of target or threshold, ideally being over that one, kind of being in our fair levels of passive immunity, 10 to 18 grams of IgG per liter of blood, being in our good 18 to about 25 grams of IgG per liter of blood, and then being in our excellent category, greater than 25 grams of IgG per liter of blood. What they looked in this study was what's the proportion of calves that are treated for disease, whether it's pneumonia or for diarrhea. What they found is that calves that are in that poor category, less than 10 grams, about 50% of those calves get treated for disease. When they looked at the fair category, it's about 30%. When they looked at the good category, it's about 20%. And finally, when they looked at the excellent category, more than 25 grams of IgG per liter of blood, they're just under that 20% mark. So clearly, what you can see is as we increase the levels of IgG that calf absorbs, we see greater disease protection for that calf. So ideally, we need to shift our mind away from being at these poor categories, the less than 10 grams per liter, to really shifting it towards having more calves that are in this excellent category, greater than 25 grams. And these are some of the targets that are proposed by the Lombard paper, the consensus group, of what we should really strive to achieve in terms of the targets. In terms of if we look at where we are today, what are we doing for passive immunity or these levels? We're falling a little bit short of these particular targets. So this is some data from our research team here at Guelph, where we went and surveyed about 100 farms. And what we found was that there's still about 19% of calves that are in that poor category. And we're approaching, but not quite meeting the excellent category. Some other work that we did here at Guelph, and this was in actually British Columbia, we found that quite a few calves are still in that poor category. We're not really meeting those thresholds. And then finally, some data from the USDA NOM studies, which was done in 2014. shows that getting pretty close in terms of that poor category, but still room for improvement in some of those other categories. So what I really want you to think about over the next part of this webinar is trying to change our mindset from this poor category and trying to really get calves into this excellent category. How do we refine our colostrum management program to ideally achieve this goal of more than 40%, or as Dr. Eagen will say in a bit, having all calves in that excellent category. So I want to really think about how we can refine our colostrum management programs. I'm sure everyone's heard of this before. I'm sure it's kind of baked into everyone's mind that we want to achieve passive immunity by making sure that we feed enough colostrum, making sure it's high quality, making sure we feed it quickly, and also making sure that we have clean colostrum. But what I want you to think about is how can we refine some of these categories to really ensure we're optimizing passive immunity rather than just kind of in the back of our mind going, these are the things I need to achieve. So how can we refine our protocols? So if we look at quantity, ideally you want to feed anywhere between 3 to 4 liters the first meal. The reason for 3 to 4 meals is that there's a recent study, or 3 to 4 liters, is there's a recent study that was published by Sabina Mann's group at Cornell University, really highlighting that this is probably where we can optimize our colostrum management. What they did in this study is they had 4 different groups. Calves were fed 6% of birth body weight for colostrum, 8%, 10%, and then 12% of birth body weight. And what that was equivalent to was about 2 liters for 6%, 3 liters for 8%, 4 liters for 10%, and finally about 5 liters of colostrum at the first feeding for the 12% group. What they found in this study was fairly high levels of passive immunity in all the groups. They fed very high quality colostrum, which we'll talk about in a second. But in the calves that received 8% of birth body weight, 10% and 12%, they had higher levels of passive immunity. So specifically, if we look at that 8% group, they had about 9 grams per liter more of IgG in their blood. In that 10% group, they had 12 grams per liter more in their blood. And finally, in that 12% group, they had 15 grams per liter more. These two groups were not statistically significant. What they also did find in this study was there's actually negative effects on the calf's well-being to feeding really, really high volumes of colostrum. Specifically, what they found in that 12% of birth body weight group is that the calves are more likely to kick at their abdomen, and they're more likely to stand up and lay down, suggesting that they have discomfort from feeding them too much colostrum. So I think we really want to change or have our recommendations focused on between 3 to 4 liters, ideally, of high quality colostrum to really ensure that we're achieving passive immunity. The other important thing, and I think one that's recently come to light, is that we probably want to do 2 meals of colostrum. I think traditionally we've done 1 meal of colostrum and then on to hopefully transition milk or a milk replacer. But there is some data or building data showing the benefit of doing 2 meals of colostrum. And specifically, this is some work that Angel Boye's group did at Michigan State University, where they looked at the probability of developing disease. And they compared 1 meal of colostrum versus 2 meals of colostrum. And really the breakdown or what they found in the study was that calves that received 2 meals of colostrum were much more likely to not develop disease or much more likely not to get disease comparatively to those that received 1 meal of colostrum. The reason for this can be explained by this study, which was done at University of Guelph by Corinne Hare. And in this study, what they did was all calves received the first meal of colostrum at 2 hours of life. And then at 12 hours of life, they received a second meal. And they received a second meal either of 100% colostrum, which is in the red, a 50% colostrum, 50% milk mix, which is in the black, or 100% milk. And what they actually found was that even feeding them at 12 hours for the second meal, they actually had higher levels of passive immunity in that group that received that second meal of colostrum. So really showcasing that calves can still absorb immunoglobulins at that second meal at 12 hours of life and still boost that level of passive immunity to really get us closer to that excellent category. In terms of quality, we really want to feed high quality colostrum. We want to pair our quantity with that quality to ideally achieve a minimum level of about 300 grams of IgG in the first 2 meals. Our traditional threshold is about 50 grams per liter. And what I want to show is really the amount of poor quality colostrum we still have out in the industry. So this is some older data looking at the US, looking at a sample of about 100 farms across the US. And what they found was when they looked at colostrum quality, measured in the grams of IgG per liter of colostrum, they found that 29% of samples were still poor quality. In a more recent study that was done in 2014, in the US also, they found 23% of samples that they took were poor quality. Another one that was done in Ireland found 44% of colostrum samples were poor quality. And finally, one that was done in Canada found that on average, we're just barely meeting that kind of quality threshold of 50 grams of IgG per liter of colostrum. So I think there's still a really big opportunity for us to focus on testing colostrum, and I'll talk about that a little bit more in a second, because we do see quite a bit of poor quality colostrum still out there on farms. So if we think about testing, I think everyone probably recognizes the importance of testing and using potentially a Brix refractometer to do so. It's a really easy process, I think, to do. It takes a few seconds to get a result. You can buy them on whatever favorite website you have, or Amazon. I often buy them for my own clients for a couple $100s, and you get your result relatively quickly. And we can be pretty confident that 22% Brix is probably the right threshold when we think about trying to meet that 50 gram per liter mark. And if we look at that 22% threshold, we have about a 94% probability that the colostrum is high quality. So we can use that threshold with pretty high confidence. Just to really emphasize the importance of testing and the importance of feeding high quality colostrum, here's a study we did at Guelph a few years ago by Alberto Lopez. And in this, we had a really poor quality colostrum, moderate quality colostrum, and really, really high quality colostrum. And what we found is that calves that were fed a really poor quality colostrum just barely meet that poor threshold on average. If we feed moderate quality colostrum, 60 grams per liter, we're going to be on average pretty close to that excellent threshold. And then finally, if we're at 90 grams per liter, we're going to really excel or really achieve that quite easily, that new threshold. So I think we want to pair that quality with the quantity of colostrum to make sure that we're achieving at least, again, 300 grams of IgG in the first 2 meals of life. Quickness is another important component. As quick as possible is really the bottom line for this. And to illustrate this, this is a study that Amanda Fisher did when she was at University of Alberta. And what she did in this study was she fed 3 different groups, either immediately at birth, at 6 hours of life, or at 12 hours of life. What she found when you fed immediately at birth is that you have high levels of IgG, and you can see that you get pretty close to achieving that 25 grams of IgG per liter. If you feed at 6 hours or you feed at 12 hours, you're never going to get close to those levels that you see when you feed it immediately at birth. So we really want to feed colostrum early on because we think the intestine loses the ability to absorb those immunoglobulins through the intestinal wall, through that penocytosis that I talked about a little bit earlier. In terms of feeding method, I think that often pairs with how quickly we can feed colostrum. And this is also another interesting study that Mike Steele's group did when he was in Alberta. And what he did in this study was he had 2 different groups, feeding calves with a nipple bottle or feeding calves with a tube feeder. And what he found in this study was that basically it's identical. There's no difference. And why I present this in pair with the quickness slide is that it doesn't really matter what you're using to get the colostrum into the calf, as long as you're doing it quickly. So if a tube feeder gets it in quicker for your farm, or a bottle gets it in quicker for your farm, that's the right choice to make. The final piece is cleanliness, and I think this is an often forgotten part of achieving passive immunity, the importance of having low bacterial counts in colostrum. When we talk about what we want to achieve in terms of targets for cleanliness, these are maybe some older numbers where we want to be less than 100,000 colony-forming units per mil for total bacterial count and less than 10,000 colony-forming units per mil for total coliform count. The reason that we've identified these thresholds is we looked at some data where they looked at high bacterial load in colostrum versus low bacterial load. They found that in low bacterial load colostrum, in this study, they were about 20 grams per liter. In high bacterial load colostrum, they're about 10 grams per liter. So really cut the absorption of IgG basically in half. The reason for why this is happening, if we go back to our kind of illustration of our intestinal lumen with these IgG floating at the intestinal lumen ready to be absorbed, if we have bacteria that's in the colostrum, what we think is happening is that these IgGs are actually going to bind to the bacteria and potentially render such a large molecule that it can't pass through the intestinal wall into the bloodstream. So that's why we think, or what we think is happening at that level. So if you think about the steps in terms of having clean colostrum, it really starts right when you collect colostrum from the cow. And this is a study that was done over in Scotland, looking at these three different time points as a potential contamination of colostrum. So what they found was that when it's collected out of the teat end, right from the mammary gland, if you do proper preparation of the mammary gland, you have fairly low bacterial count. So basically almost zero in this particular study. When they collected the colostrum from the collection bucket, it went up to 100,000, so just under our kind of goal of what we want to achieve for clean colostrum. And then finally, from feeding equipment, you can see that it was way above what we want to be our threshold. So if you're struggling with not having clean colostrum, you probably want to look at your collection process from the start to the end, starting at the teat, all the way to the collection bucket, making sure that that colostrum is not sitting at room temperature, and making sure that you're cleaning your feeding equipment appropriately and well to really reduce the counts of bacteria. The final consideration, I think, that's also quite important is that we want to quantify our success. I think for a lot of farms, for a lot of veterinarians that are out there, we don't do enough of this. We don't really test how well are we meeting those thresholds. Because if we don't know a good starting point, we don't know what the impact will be to altering or changing our colostrum management program. For quantifying, it's quite easy, I think. Take a blood sample, ideally in the first 24 to 48 hours, and I'll show some data on that in a second. And then spin it down or let it sit in the fridge overnight, put it onto a refractometer, and it gives you a result. I think it's a pretty simple and easy test that we can perform, I think a little bit more regularly to ensure we're meeting some of those thresholds that I highlighted before. When we look at Canadian data, this is from a few years ago, we found that only 26% of farmers that we surveyed actually had tested for failed transfer of passive immunity at least once. So not on a routine or regular basis, just testing it at least once. So I think there's a big opportunity for us to really expand into this area. There's lots of different options from radial immunodiffusion, which SCCL offers, depending on where you are in the world, or using bricks or serum total protein. That can be a good starting point to really evaluate how your success is looking. There are some challenges, however, when we think about quantifying passive immunity. So if we think about using serum total protein, which is really commonly used out there as an indirect measure of IgG in serum, we did a study a few years ago, also by Alberto Lopez, where we took some data that we had from SCCL, and we looked at the correlation between serum total protein and IgG for both maternal colostrum and also for colostrum replacer. In this study, we had about 1,500 calves fed maternal colostrum and about 1,500 calves that were fed colostrum replacer. What we found when we looked at maternal colostrum, which is what this graph is illustrating, is that we had pretty high correlation. You can see all the dots are pretty close to that straight line, meaning that if we had high levels of serum total protein, we can be pretty confident that we had high levels of serum IgG. So I think if you're feeding maternal colostrum, that's totally okay to use as your standard to evaluate it. What we did find, however, is that on farms that were feeding colostrum replacer, or in calves that were fed colostrum replacer, there's a little bit more scattering around this line, meaning that it's not as well correlated. So you can't say that with great confidence that if you're at high serum total protein levels, that you're at high IgG levels. So I think we need to be a little bit careful in how we're quantifying passive immunity, especially in calves that are fed colostrum replacer. The reason for that, or reason that we think that this correlation is poor, is perhaps because colostrum replacer has a slightly altered protein fraction in the calves, but we're still trying to identify the reason why. The final caution I'll have with quantifying passive immunity is we want to make sure that we're actually taking the blood sample at the right time. I think at a lot of farms we kind of say, yeah, between 1 to 7 days is okay. But I don't think that's totally correct if we want to be accurate in identifying passive immunity. And this is a recent study that we published where we took 400 calves and we sampled them on a daily basis for the first 7 days of age. And then we looked at the levels of IgG in these calves. So this is the IgG here. We got day of life on the bottom. What we found is that 24, 48 hours of life, basically identical. There's no major differences if you take it on the first day or the second day of life. What you do note is that as you get to day 3, you start to see depletion, and by day 7, the result is almost half of what it was on day 1. If we look at this on the Lombard scale, this is what the kind of pattern looked like on day 1. And again, these are the same group of calves through time. So on day 1, you can see it had very, very low levels of poor passive immunity. We had a lot in the fair category. But if we zoom out to day 7, you can see that almost 50% of calves are now designated into the poor category. So if we want to be accurate in how we're quantifying passive immunity, it's really important that we sample these calves on the right age, and ideally at 1 or 2 days of life. So how I want to wrap up this presentation is just with kind of my ideal colostrum management protocol, and I thought I'd just quickly outline it. Ideally, you want to collect the colostrum immediately after calving because we know that IgG depletes rapidly from the mammary gland of the cow if we wait too long to collect it. We're going to test it. Ideally, make sure it's greater than 22% on the brick scale. If it's greater than 22%, we're going to feed as is. If it's less than 22%, we can enrich with colostrum replacer, which Dr. Eagen is going to talk about in a second. And then ideally, you want to feed 3 to 4 liters of that high quality colostrum within the first 4 hours after calving and follow up with a second feeding within the first 12 hours. And if you do that, I think you're going to see consistent high levels of transfer passive immunity and really achieving, if not exceeding, those levels of excellent passive immunity. So is that some takeaway messages that I hope you learned from this presentation? Is that colostrum really is foundational. It's the foundation that sets that calf up for success for really the remainder of its life. Helps prevent disease, helps to get it going in terms of its gut development and microbiota development. We know that the success really depends on these 4 key criteria: feeding enough colostrum, making sure it's high quality, feeding it quickly, and having clean colostrum. And it's really important, I think, to ensure that you're checking how good are you doing with passive immunity. If there's one thing that you take away from the presentation I just gave, it's really I want you to go back and take blood samples on your farm to really see where you're at. Because if you're doing exceptionally well, if you're meeting those Lombard scales or Lombard thresholds, you probably don't need to make big changes to your colostrum management program. But if you're not, there's probably a big opportunity to reduce the levels of disease and to really improve the overall performance of the calves. So with that, I'd like to thank all the students that did all the research. There's a couple in here that did some of the research that I presented, all the funders of this research, and I'll switch over to Kim.
Right. Thanks, Dave. You did have a couple questions in there on serum IgG corresponding to the refractometer. I think you maybe answered that within your presentation.
Yeah, so I think the serum IgG that we found was pretty highly correlated when you feed maternal colostrum. And in some more recent work, we've actually found that if you take the blood sample in the first day or first 2 days of life and you feed colostrum replacer, it also is reasonably correlated as well. And then I see the second question there for bottle fed versus tube fed. What do you do if the calf didn't want to finish the bottle? I think you tube them right away. I think that it's important to just get the colostrum into them as soon as possible. And if you start with a bottle feeder, they don't consume it right away. Just tube them as quickly as you can.
Super.
Awesome.
Stay
Over to you, Kim.
Okay, I will share my screen here. Okay. All right, so you should be able to see that. So yeah, thanks for the opportunity to join. My name is Kim Eagen, obviously. I'm based here in Wisconsin and I do some technical service consulting for Saskatoon Colostrum. Work with some large Midwestern dairies and also work with teammates across the country and even in other parts of the world on helping farms to make the most successful future herd that they can. And I'm just going to kind of reiterate what David just went over, all in one slide, not as fancy as yours, Dave. So yes, as quickly as we can. The quantity and the quality really, as you mentioned, combine. I I definitely support 25 bricks or over for a threshold. I have not met a farmer yet who said they would like their future herd to be adequate. They would like them to be excellent. So we're shooting for that. We're going to shoot for that 300 grams of IgG within the first 12 hours. Um, some more recently proposed cutoffs for clean was less than 50,000 CFUs on a standard plate count. That would be for fresh maternal colostrum. And in in talking to producers about cleanliness, I don't see a lot of people doing standard plate counts on their colostrum, even though, at least here in the US, we're doing that routinely on our bulk tank milk. So I think that's an opportunity to engage a little more monitoring on that end and certainly checking our equipment for cleanliness, as you mentioned. Um, and then cooling rapidly after we collect will minimize that bacterial count, keep it from expanding over time. And then warming that up gently after we have stored our colostrum to avoid denaturing any of our antibodies. So you talked about testing, and this is really, using the bending of light to estimate. It can be very well correlated. Um, and that is measuring, the solids that are in there, the bending of light. So when we say we're measuring IgG, if we're talking about bricks, we're not really measuring IgG, we're estimating IgG. And I think that's important to understand sometimes if we are looking at our bricks results on our calf serum, for instance, I'm not going to make a decision about an individual calf. Rather, where are our results fall, how many percent do we have failing or in that poor category, to monitor how our overall program is working. So, pasteurization, even if we are denaturing some IgGs, that's not going to change the bricks. So they're still going to be in the colostrum, but they may not be as effective. So that's another thing to keep in mind when we're looking at testing. Like Dave said, I also recommend the digital refractometer. It it is a little bit more of an investment, but it's really compared to the cost of one calf, it is not that much. Very easy to use. Just a reminder that they do need to be calibrated. I recommend doing that every day, and certainly testing all samples of colostrum. As I mentioned, the other part of testing would be testing for bacteria routinely, maybe once a month to take a few samples and just make sure that nothing is really getting out of line. I'd say over that 50,000, but certainly it should be under 100,000. That was the old standard. And ATP meters measure bioluminescence. That can be a really quick, rapid monitor on that equipment. Those are a little more expensive, but generally a calf health consultant a university extension agent. There may be somebody available if you're thinking that that's a problem to really measure the cleanliness of that equipment. Those are very handy to use as well. So if you do have a collection of colostrum that is not reaching that 22 or definitely the 25, you can certainly make every collection of colostrum into an excellent feeding within those parameters. And we'll get to some guidelines later. But by enriching. So this is really just adding whole bovine dried colostrum powder into maternal colostrum to increase the Brix and increase the concentration of IgGs. It doesn't matter if you're using an SCCL product, we're not going to use different products, get different amounts. Based on the total solids, they can all be used similarly. And I think one key here, when people have questions, is that they're not warming the maternal colostrum adequately. So if we were going to mix a replacement feeding, we would use warm water. The colostral fat really needs to dissolve in that warmth. That's the temperature we're going to want to be feeding the calf after we mix it. So 110 to 120 Fahrenheit is a great temperature for that maternal colostrum to be warm to mix in the additional powder. When would we want to do this? So you want to use the herd's maternal colostrum if it is clean and you have good management practices for collection already. You really want to drive optimal results and get every calf an excellent first feeding. And you don't want to have diseases of concern being fed to the calf. So if a yoni is positive, you don't want to collect from them. So you're making more use of other colostrum. You can still use your maternal. So taking that colostrum from good to great. Looking at absorption considerations. So on this chart, you can see the apparent efficiency of absorption on the vertical column. So the percent of IgGs that are actually absorbed. Some of them flow through the intestines and are not absorbed. And that's normal. On the black line with the red diamonds, that's a normal calf. Under that is just a plain red line. That would be a calf that is stressed, possibly from heat stress in utero from the dam, or a dystocia calving is another good example. Those calves do not absorb as well. And you can see at the bottom there, that's, maybe a 20% reduction in absorption ability. So these calves may need some extra help, and just having a good feeding is probably not going to be enough for them to help overcome that. So for these calves, for sure, we want to make sure they have an excellent feeding so that they don't fail passive transfer or end up in that poor category. So potential programs enriching all colostrum to all calves certainly is an option if you want all your calves to be excellent. We used to say enriching high value calves. If you're spending money on embryos, that would be a good example. Really, all calves are high value currently, so that would be going back to the all calves. Enriching calves that have extended time to first feeding. So if there is not monitoring overnight and a calf is already standing, already dry, you're not sure how many hours since it's born, that would be a really good reason to make sure we're getting that excellent feeding. And as I mentioned, the stress calves. And if you have a standard in your protocols for that level to be excellent, then it's certainly a very easy method, and we're going to go into how that works. So these are my guidelines, and I said less than 20 Brix on that maternal colostrum collection would be a good area to just replace with whole bovine dried colostrum for that first feeding. That could be used for a second feeding, that could be used in transition feeding. But for a first feeding, that's a little too low. 20 to 24% bricks is a great place to use enrichment to get them up to an excellent feeding. So certainly this would not apply to all collections, but every farm has some collections that could be enriched or should be enriched to improve that quality of maternal colostrum, to help overcome absorption issues. And it can be implemented in a few different ways, either precisely or just generalized. So if farms are not testing every collection of colostrum, I would suggest that at least during every season of the year to take some samples and find out where your average is. And then you could presume that that is what you have for all samples if you just don't have time to do it on every single batch. But ideally, every collection of colostrum would be tested, would be marked if it's going to be saved for later, either in the refrigerator or the freezer, with the date and the bricks concentration of that colostrum. So the old myth that you can tell if it's good by looking at it is definitely a myth. It is not true. There is a QR code here that will take you to an app. You can look on your app store yourself for the colostrum calculator. This I really like. I think it's very simple for anyone to use, and it is available in Spanish and English, maybe Portuguese. I know it's available in more than English. So if you have, for example, 3 liters of fresh maternal colostrum, you would enter that. If it is at 21 bricks, you would enter that, but you want it to be 25. That's your goal. You enter that, and it will tell you how many grams of powder that you would need to add to bring that up to your goal. So very quick and easy to use. As I mentioned, if you are just getting an average, you're not going to calculate every time. You could use kind of a rule of thumb. So if you have that same 21, you know you need to raise it at least a few percent bricks, 100 grams of powder in a 2-liter bottle. At the 1, 2, 3 rule, 100 grams of powder in a 2-liter bottle of maternal colostrum will raise it about 3%. So you could also use that kind of rule of thumb. There are charts as well. I think we have on I don't have that on here, but we have those available as well. And there might be one on the SCCL website. Maybe Sydney can grab that in the chat if that is there. But that works the same as the colostrum calculator. Where's my maternal? Here's where I want it to be. This is how many grams of powder I need to add. And as Dave mentioned, the importance of a second feeding. So they're not absorbing as well, but they are still absorbing those IgGs, and that's really the only chance we get to build a calf's defense system. So a quality second feeding as well to get those IgGs in. So I think we want to at least use that 22 to make sure that we're getting a good second feeding in as well. And enrichment could also be used there. For example, on that 20 bricks feeding, now if we bring it up to 22 for a second, I think that would be a good protocol. And why Saskatoon colostrum? I think that's a pretty important key here because we know that this is a safe product. We know that it has been tested for efficacy to prevent failure passive transfer. We know it's disease-free. We know that lots are tested to guarantee potency, purity, no, nothing added, nothing taken away, just whole bovine colostrum. And through the same rigorous testing as any vaccine, a veterinary biologic. But so licensed by the USDA, and in Canada, that would be the CFIA. So very well trusted products, and that would be my recommendation for enrichment purposes as well. So that is what I had. Thanks for listening.
Thank you so
See
much.
if we have a few more questions.
Yeah, we have a few that have rolled in. Thank you. I want to reiterate, thank you, Dr. Kim and Dr. Dave, for your amazing presentations on colostrum and the importance and our base management and how to really elevate that. So with that, we can kind of jump into the first questions. The first one is for Dave. What is your take on total protein that are higher than 8 grams per deciliter?
I think when you run into that kind of level, it makes you kind of wonder, is that calf dehydrated? Is there something wrong with that calf? So I think what I would try to troubleshoot is if you're seeing a lot of those levels, maybe looking at those calves and seeing if they're dehydrated, making sure they don't have clinical signs of disease when you're testing them. That's probably what I would try to dig into.
Thank you very much. We have another question on how often you would recommend a large farm test a group of calves for IgG.
Kim, do you want to take that one, or you want me to grab it?
Sure, and if you if you want to, I'll share first and then you can chime in. So I think looking at the ideal time to test, if you're testing once a week, I would do those calves that are 1 to 2 days old. 18 hours, I would say, is the minimum to make sure they've had a chance to absorb the colostrum you've fed them. And however many calves that is. If it's a small number, you could test every day to get all your calves or every other day. I guess that's a labor issue, but certainly to get a good sample size, a good representative sample.
Yeah, I think you can initially test and like Kim is saying, try and get those calves in the right time frame and see how well you're doing. And if your farm's doing really well, I mean, you spot check it. You do it every once in a while, every month. Maybe you try and do a test of a representative sample of calves and kind of go from there. But if it's not going well, I think that's where you want to do continued monitoring and ensure that changes made to your colostrum management program are really improving.
Thank you both. We have a question regarding if calves that receive a first meal of enriched colostrum, is there any evidence or I guess anecdotal, anyone noticing that it's refusing to take a second feeding of colostrum following that?
I'll take this one first. So this is something, I've fed calves. We had a dairy farm. If they're getting a big first feeding, yeah, a lot of times they're full, their stomach is very full, and they don't want to eat a second meal. And I think that's another thing that is a beautiful part of enrichment is that first feeding of colostrum, we do have quantity on our cues, but it's not all about quantity. If you have a high concentration of IgGs, then you could get 200 grams of IgGs in 3 liters if you're hitting that 25 or above. So I wouldn't be afraid to enrich, to look at that kind of option. A gallon is not magic if it is not high concentration IgG. So as long as we're hitting that 300 grams of IgG on the first day or the first 12 hours ideally, That second meal, though, if you need to, I would say wait 6 to 8 hours before the second meal. If it's at 12 hours, that's the study we looked at. They still increased their serum levels of IgGs, so that's fine. But it is important to get some more into them then. If you have to tube them again, I would recommend that. But yeah, try a smaller amount that's enriched.
Okay, thank you. If you have a calf with poor passive transfer, should you give more meals of colostrum after 24 hours of age, or when calves are sick or have diarrhea? Is that a potential opportunity there, or is it kind of just after that 24 hours, kind of a one and done?
Yeah. So they're not going to absorb any more IgGs after 24 hours, so they would still fall into that poor, failure of passive transfer category. Certainly having IgGs flowing through the intestinal lumen after that can help, bind pathogens still and provide nutrients. So Dave, if you have thoughts on that as well.
Yeah, in a study, we haven't quite published it yet, but we found that calves that are in that poor category probably benefit the most from receiving either transition milk or extended colostrum feeding, where you're supplementing very small volumes of colostrum or colostrum replacer daily for the first 10 to 14 days. That's where you might see benefit in identifying those calves and maybe supplementing them with an additional transition milk or extended colostrum feeding.
Great, thank you. There's a couple questions here that I think are kind of overlapping, so I'm going to kind of ask them as one shot here. But there was a few studies that were presented. Is all of this study based in Holstein calves? And are there breed differences when it comes to colostrum management, their ability to achieve excellent passive transfer, or anything kind of in that colostrum space?
Yeah, a lot of our studies are based on Holstein calves. The crossbred calves are pretty similar in terms of birth weight, so I think you could probably make a statement that it's probably pretty similar between Holstein or Holstein Angus or Holstein crosses. For Jersey calves, I think the recommendations are a little bit different. I don't think you want to feed probably 4 liters of colostrum. It's probably way too much for a little Jersey calf. It's probably getting closer to like 2.5, 3 liters at the first feeding, potentially as kind of the maximum volume you want to provide. So a lot of the recommendations that I had in my presentation here were based on Holstein.
Thank you. A few questions are kind of floating around this idea as well. Is it possible to over-enrich? One example is someone's heard in a previous presentation that enriching to over 24% renders it basically useless, changes osmolarity. So is there concerns with that of boosting it, and can we push that too far?
Think my short answer would be on that first day of life is when we're talking about using enrichment. And at that point, those channels where the IgGs are absorbed are so open in that calf that I'm not worried about osmolality on that first day. Um, Certainly for calves that are, in high heat stress areas like the southern US, going over 25 to help overcome that has been suggested, and we've seen good results doing that. So even up to 30 on, for some special situations.
Okay. Dave, any thoughts to add or?
Yeah, I think yeah, Kim's right. I think osmolality probably isn't too big of a concern in the first meal of colostrum. We did another study that we haven't published, mostly led by Mike Steele, where we tried to have really, really high osmolality colostrum and see what the impact is on diluting it to different levels. And high osmolality didn't really have an impact on absorption of IgG or really on calf health or level of diarrhea or anything like that. So I think in early life, in the first day of life, high osmolality probably doesn't make that big of a difference.
Okay. Thank you both. Um, We have a beef question, so I'm going to let my biases show and ask it. But is the threshold of IgG needed for successful passive transfer, is it the same in beef calves as it is for Holstein or dairy calves rather?
No, I think we need to achieve higher levels in beef cattle. I think if we look at our typical dairy calf, mostly our thresholds are about 10 grams per liter. It's traditionally used. Whereas in the beef industry, it's like closer to 24 grams per liter. Beef cattle have much higher quality colostrum, so I think it's maybe easier for them to achieve that when you pair it with monitoring to make sure they're intaking the colostrum and that type of stuff as well. So I'd say you want to achieve higher levels in the beef industry.
Thank you. Another colostrum management question. What are each of your thoughts on pasteurized and unpasteurized colostrum for transfer of passive immunity and microbial colonization? What would be more beneficial?
I'll go first. So I think the key is pasteurization is not sterilization. So if you are doing a good job being clean, it will make it better. If the pasteurizer is properly cleaned and maintained. So it can be a great tool. Those are my thoughts.
Yeah, I agree. I think if you're struggling with colostrum cleanliness, I think pasteurizers certainly have a big benefit, and they've been shown that they can pretty reliably reduce the level of bacterial load and certainly improve the absorption of IgG when you have contaminated colostrum. But I think it really depends. Are you struggling with colostrum cleanliness? If so, I think that's where pasteurization really does fit nicely.
Thank you both. We have a question about the correlation between grams of IgG per liter and Brix percent. And so you both can correct me if I'm wrong, but I think it's 22% Brix is 50 grams of IgG per liter. Is that correct? Yeah.
Yep, that's right.
Yes.
And then 25% Brix is probably 75 grams of IgG per liter. And then if you're at 30% Brix, it's probably 100 grams of IgG per liter.
We had a question about the study in comparing tube feeding and bottle feeding and what happened with the calves if they didn't drink or did not finish the bottle that was offered to them. So what happened in those cases? Could you remind us?
Yeah, in that study, all the calves actually consumed the meals of colostrum.
Okay.
So there's no, which is a little bit unusual to be honest, because I wouldn't expect that. But in other studies that we've done where we've had nipple bottle tube feeder and then like a nipple to tube feeder group, the calves that are always in that nipple to tube feeder group don't do as well because there's something probably compromised with that calf. Maybe it was born from dystocia, maybe it's hypothermic or something like that. So yeah.
Yeah, if they don't finish their bottle, the rest of it should be tube promptly. Don't let the warm bottle sit there, or bacteria are going to replicate and cause you more problems.
Okay. We'll answer one more question and then we'll wrap it up. But we have a question about the recommended practices for freezing and thawing colostrum. Do you guys have any general recommendations for how that should look or how best to manage that?
Yeah, shout out to the person that asked the question, actually, one of our clients at the university. Thanks for coming. Yeah, I think the biggest recommendation is that you want to cool it pretty quickly. So you want to make sure that whatever you do, you're collecting it. If you're going to put it in a freezer, you want to collect it and then you want to start cooling it immediately. I think if you just put that big tub of 4 liters or however much colostrum into the freezer right away, it takes a long time for it to get down to like a proper cool temperature. So collecting into like have your bucket, have a bunch of ice around the bucket, that can be quite helpful or something of that nature. So ideally, you're cooling it rapidly because you're reducing the amount of bacteria that's going to grow into it. how you freeze it is ideally in kind of flat packages because you want to have good surface area for however you're reheating it to warm it in appropriate fashion. Um, and then also, I think the second part of that question was reheating it. There's lots of different ways that you can do it. There's commercially available options that you can use as well. But what we started seeing on some of our smaller Canadian farms is using a sous vide, which is a cooking device. It's a nice way to have a standardized temperature over an extended period of time. So if you pair that with kind of a flat surface, put it into a warm water bath, ideally between 40 to 60 degrees Celsius, and let it thaw over that period of time, and then feed it to the calf, you should have pretty good success. And I'll throw it over to you, Ken.
That's less than 140 degrees Fahrenheit for the Fahrenheit
Yes.
users in the audience.
Appreciate it.
Thanks,
So,
Ken.
yeah. We don't want to cook it or try to pasteurize it while we're thawing it out. Um, yeah, I think you covered that well.
Mhm. Well, any final thoughts from either of you regarding enrichment or colostrum management? No?
I
Yeah,
had one while Dave was talking, but I lost it.
I think my final thought is just, yeah, focus on, like, it's amazing what colostrum can do. If you really focus on that first feeding, those first two feedings, you're setting up that calf for the rest of its life. And I think that spending that extra 10 minutes, 15 minutes, maybe checking the colostrum quality, enriching it if it needs to be enriched, and doing kind of all those steps makes a huge difference. It saves you time in terms of disease treatment. It saves you money because they're going to be more profitable and productive in their future life. So that's kind of my take-home message.
Yeah, make them excellent.
Yeah,
Yeah, 100% excellent.
there we go. What a way to end it. Okay, I want to thank you guys both so much for your thoughts and your ability to answer these questions, as well as your fantastic presentations. But with that, thank you for those who joined us, and we will see you next time. Have a great evening.
Thank you.
Thanks, everyone.